We're going. Dr. Gary Morsch, thank you for joining us. You are all over the place.
Well, COVID is all over the place. So that means I'm going to be all over the place.
Well, last time we caught up with you, we had you in studio. So we have to tell everybody we are in safe places and you're quarantining. But at that time, you were still
Yes.
focusing on heart to heart and your docs who care. And boy, has the world changed since that time. If you will share with us what you're doing now and this new organization you've put together in response to what's going on in our world.
Sure. I've got one of my staff out on the porch because I think they're on the Wi-Fi, and I'm going to ask them to get off of the Wi-Fi so we have a better signal.
Okay, I'm going to stop then.
Mm-hmm.
So, Dr. Gary Morsch, we've got you. But last time we had you in the comfort of our studio. This time, you are quarantined, and I'm in a safe space. And we need to bring everybody up to speed on what you're doing. Heart to heart, docs who care, and this whole new effort because of the COVID-19 situation.
Well, thank you, Ruth. And I wish I was in the studio. It's fun to see the people coming and going. The last time I stepped out of your studio, I ran into Danny O'Neill and Barnett Hellsberg, two of my good friends and favorite people. So who knows who I'd run into today. I was probably born a volunteer, and I grew up in a family of people that volunteered and really believe the biblical mandate that you and I both believe in, that we are to give our lives in service to each other and to take care of each other. So that's what I've been doing my whole life. And I believe that is my calling, even as a medical doctor. So when I went into medicine, I decided I would get involved, and I would give of my time, talent, and treasure to serve the marginalized, the needy, the poor, the uninsured. And I've been doing that for a long time. I quit my practice 28 years ago to start Heart to Heart International. In that organization, I continue to be involved. I'm the chairman of the board of the Heart to Heart International Foundation. And that organization is incredible. We've now delivered over $2 billion in medicines around the world. We have Heart to Heart volunteers in New York City right now and Chicago. And I led a team to New York City 2 weeks ago, and partly from Heart to Heart. Half the team was Heart to Heart, and half the team was this new effort I've stood up called the COVID Care Force. So when COVID hit, I knew that I feel, and I still do, that this is the greatest disaster of our lifetime. I think it's the greatest, it may become the greatest disaster of the modern era. The more people will die, more economic disruption, more poverty, more economic damage than even the the Spanish flu of 1918. I think this has possibilities of being as bad as any plague in the Middle Ages, the Black Death, they called it, because if the greatest nation in the world already has approaching 1 million cases and approaching 50,000 people that have died, and that's just the start of it. We don't know how it's going to end. We hear it's flattening in New York. We hear it's flattening perhaps here in our community, but the death rate nationally continues to go on almost a straight line. It hasn't flattened. So I felt like I needed to do everything I could as fast as I could, as risky as it might be. And so I was in Asia, traveling in Asia, when the outbreak we heard about it from Wuhan. I was in Indonesia, Malaysia, Philippines, and I sensed right then this will reach America, and it's going to be a worldwide pandemic. And I came home through LA, and there was no checking my temperature. There was no asking me where I'd been. I just came into the United States from a flight from Manila, the Philippines. I went almost immediately to South America, where I had some meetings already set up. And when I arrived in Brazil, they checked my temperature. They questioned me. When I flew to Panama, they did the same thing. When I flew to Ecuador, they did the same thing. When I flew back to the United States to Dallas, Fort Worth, no temperature, no questionnaire. I knew then that the United States probably had COVID all over the place. If I was getting in, think of people from, you name it, that are COVID positive that were coming into our country. So the cat was already out of the bag or whatever. And I knew then this is going to be terrible. So I immediately started strategizing. I went to the two organizations that I still lead in some way, in some position. That's Heart to Heart International and Docs Who Care. Docs Who Care is a emergency department staffing company that I started some 25 years ago. We work all throughout the Midwest in small hospitals. I went to Heart, and I said, this is going to be bad. We need to be ready. And both organizations said, we will support you in whatever, but we're busy with what we're doing, our normal things. And Docs Who Care said, we're busy just keeping doctors in 100 some emergency rooms around the Midwest. So I said, you know what? I just need to start another effort. I just need to bring in staff, bring in volunteers, and get something organized. And that's how the COVID Care Force was born, just 3 weeks ago, maybe 4 now. And since then, we are a not-for-profit organization and a 501c3, and we have already we have hundreds of doctors and nurses from around the country already applied to be volunteers with us. We, it's just taken off like wildfire, just like Heart to Heart did, maybe how Docs Who Care did. So I'm busy 12 or 15, 18 hours a day. Just got back from New York, as you know, and had a great team there. But we're now getting ready to deploy some 25 doctors and nurses to the place in the United States that has the absolute highest incidence of COVID, way more than New York City. And I'm glad to tell you about what we're doing, where we're going to be going next week.
The fact that you were able to do this and be so nimble is just amazing. Can you tell us a little bit about how you were able to make that happen so quickly? It seems sometimes we get caught up in, oh, we have to do all this procedure, but bang, you saw this need and off you went.
Well, I've learned a lot from Heart to Heart and Docs Who Care, and I've learned from the military. I'm retired. I was a colonel in the military, in the Army, and I was a commander of a combat hospital and served 3 combat tours. And so I've learned how to organize things and what pieces need to come together quickly to make that happen. And then I'm a risk taker. I'm willing to put my own money. I pledged $100,000 to do this, and I didn't tell my wife, so my wife's not real happy about that. You should always discuss these things with your spouse, and I forgot to do that because in the heat of the moment, but she's okay now. And I got attorneys from Lathrop Gage to help me file the 501c3 papers and, of course, incorporate. and then we filed our trademark with the U.S. Trademark, and we're the first ones to file with that name. And at the same time I was doing that, I organized the global care force, because I know COVID's not going to be the first or last of these pandemics. We live in a world where you're going to start seeing this happen. So I probably will spend the rest of my life mobilizing people to respond very quickly as volunteers throughout the world. I knew what needed to be done. I was willing to put my own assets or whatever, my own energy. And then people like you, I have a great network in Kansas City and throughout the country of great friends and people who've inspired me and supported me and advocated for me and the ideas that I've had over the years. This isn't there's other not-for-profits I've started. There's other work I've done, but I have so many people that are willing to, when I call them or email or text, they're all in. One of them is U.S. Senator Jerry Moran on the Kansas side. He called me in New York on my cell and just said, "This is Jerry. I hear about what you're doing. Tell me what I can do for you." And that's the kind of support from both sides of the aisle, from governors and from politicians and people in business, Fortune 500 companies, and Trent. And then I have such a great network through a lifetime of being in medicine, of doctors all over the country that have been a part of my missions in the past and know about what I'm doing. And so we've just gotten the word out, and it's happening. So and it falls apart. Okay, that's fine. I tried, you know.
Well, what you all are doing is incredible and very unselfish work. We should tell our listeners and viewers they can go to covidcareforce.org, check out
Exactly.
all the details, try to keep up to the minute with you all because you're moving so fast. Tell us a little bit about who your volunteers are and then how others can help you.
Uh-huh. So the first volunteers I always call on, whether Heart to Heart is organizing the disaster response, which Heart to Heart does every disaster and has for many years, many of them are often the doctors that work for me in my Docs of Care. So, and I formed that group with the idea that our doctors would be able to be flexible with their schedules in the ED. And when a disaster came, we'd all pitch in and help cover each other's shifts. And the people that wanted to go would be able to go. And that's a trait of Docs Who Care. And that's why a lot of doctors want to work for my group, because they know that they'll be blessed if they call us and say to the office, say, I want to join the Heart to Heart team that's going to Nepal or whatever, and they want me to go, 2 days from now. Can you cover my shifts, get my shifts covered? And everybody on my staff knows the answer is yes, of course, because that's why I started the group. So the first round of volunteers are often people that I have worked with here in the U.S. who volunteered with me through Heart to Heart and other organizations. The second round then are people that that are on my personal email list or my Facebook friends, and because that's an easy thing to get out, an announcement. And then we start working the channels. One thing that I didn't have 28 years ago when I started Heart to Heart, you didn't have websites. And I'm not even sure, certainly was an email, and it was pretty crude technology. Nowadays, it's a whole different story. And one of the first things I did was hired a friend of mine out of Florida who has a company that designs websites and maintains them. And his team of 5 or 6 people started working nearly 24 hours a day about 4 weeks ago so that we could have a website in 1 week. And when people go to covidcareforce.org, they're going to see a very sophisticated website. And we're still working on it and improving it. But you can hit a button to volunteer or serve, and it takes you right to an application. You can hit a button to sign the COVID pledge, which means I pledge to follow the public health guidelines, which are now wear a mask when you go outside. And every time I go out, I've only been home for 2 days, 2 nights, one day. And so when I go outside, I live on a farm. I still put my mask on. I just need to get in the habit. I wear a mask. And the crazy thing is, flying into KCI 2 nights ago, most of the people weren't wearing masks around the airport. And as I drove home, I saw people walking on this, walking down this. Most people aren't wearing masks. Now, 3 weeks ago, before I left to New York, when I went to the grocery store, no one had a mask on. My wife tells me that even now, when she goes to the store, there's a lot of people that aren't wearing masks. I don't know what your experience is. That's dangerous, very dangerous. So we have to take this very, very seriously. And so what I'm doing now with our website, so you can sign the pledge that says, I'll wear my mask, I'll wash my hands. And if they say the stay-at-home order is extended, I'm going to stay at home. So we got to do that. And then, of course, you can hit a button and make a financial donation, and we need that because we're paying for the airfare, the housing, and food for all of our volunteers. Now, they're not getting paid to work. They're volunteering, but we're covering all their expenses. Now, in some cases, the hospitals will give us that. In New York, the hospitals that we worked in were giving us that. And then the organization we worked with, the International Medical Corps, great organization out of Los Angeles, they provided our airfare. But for our next mission next week out west, we will be covering that ourselves. So we're raising money. So I always say to people, if you can't go, please consider supporting someone who can go in your place and literally be on the front lines of COVID.
And again, that's covidcareforce.org.
Mm-hmm.
And I just want you to know, I do have my mask. I didn't think it'd be good to wear it for an interview since we're not together.
I was going to get mine, but yeah, I have mine right here on the table.
And not to do a commercial, I also have my reading. I have my Dr. Morsch book, which is one of several. You'll Never Be the Same, Transforming Your Life by Serving, which we believe in. Well, I know you're holed up, but you're not here for long, and we just appreciate it. And so we can't be together, but at a time when we are, here's your virtual gift of our coffee mug.
Thank you.
To be redeemed at a time where at least we can be safer, or be closer together than 6 feet.
That's right. But feel free to call me or contact me. I'm headed west to the